everybody, Dr. Caitlin here with Fit PT. Today I'm going to show you how to do some pelvic tilts laying down on your back. I am actually going to do these pelvic tilts with my body or my pelvis placed on top of this Pilates or bender ball. You can actually opt to do this on the floor without the ball, but I do find that I really like the sensation of the ball assisting with the motion, and I also feel that it's a little easier to see visually in the camera. So just know that you can do this both with and without the ball today. So I'm going to go ahead and flip on around, laying on my back. My feet are going to be about hip width apart, and on the floor I'm going to push into it to create an extra big bridge so that I can get that ball underneath. Okay, so if you're not using the ball, you will just lay your pelvis flat on the ground. My arms are going to be at my sides, and then basically what I'm going to do here is I place the ball kind of at the small of my low back, where my low back meets my pelvis. Okay, so my butt's elevated just a little bit. So I'm going to follow my breath here. In a moment, I'm going to inhale, and I'm going to think about expanding my rib cage all the way around. So I'm not just breathing up to down, I'm also breathing out and back, almost like my lungs are a balloon. And as I breathe in, I'm going to fill my balloon up. Okay, so you'll probably be able to see my belly move in the picture, but maybe not my ribs so much, but they are moving. And then when I do that big breath in, I want you to think about doing a big arch in your spine. So if you're familiar with yoga, you're going to think about cow pose and rounding your body like a little rainbow here. As you exhale, I'm going to draw my navel down. I'm going to lift my tailbone up, my low back goes down. Okay, so this is like cat pose on my back. Inhale, I'm going to fill and rise. Arching my body away from the floor. Exhale. Lowering my body or my back towards the floor. Inhale. Exhale. So I'm just going to the rhythm of my breath, and I'm also just moving as far as my body lets me. Now you can place the ball, if you feel like you're getting stuck, you can place it a little higher. There's kind of a happy medium space there. I feel like mine was a little low. Now I'm getting a better arch or cow pose, and I can still exhale cat pose. Okay, if I have my hands on my pelvis, creating that pelvic triangle, tilting back and forth. This technically is called an anterior pelvic tilt, if that's how you know it. Exhale, posterior pelvic tilt here. Now, if you happen to be searching for a neutral pelvis, if that's something you're working on with your provider, therapist, or trainer, your neutral pelvis is going to be where your hip points and your pubic bone are parallel to the ceiling or to the floor. So we're moving past parallel with our pelvic tilts and our breathing, but if you were trying to search for neutral, it would be right about here. All right, so that's pelvic tilts. Now, if you wanted to do pelvic clocks or circles, basically you're going to think about making like a hula hoop kind of mechanism with your hips, shifting all the way around, bringing out your inner hula girl, and then you're going to move around in a circle. Now, this is easier said than done, okay? This is even really hard for me, and I get to practice this all the time. So know that if it looks easy in the video and it feels hard in your body, that's okay. You'll work on it. But I'm just thinking about moving that pelvis around in a full clockwise motion. And then naturally, after a few there, I'm going to move around in a counterclockwise motion. This is one where I find some of my clients really do well with their pelvis on the ball, and then other clients I have really need to take the ball away and do this on the floor. So you may want to experiment with both for you, but both of these things, these pelvic tilts back and forth and pelvic circles, both directions, are really healthy movement patterns for the pelvis. Okay, taking the ball out. If you want to, if that aggravated your low back or pelvis in any way, I just like to reset with a little rocking side to side, knees to chest, just to get a little flexion and massage through the low back. Okay, there we have it. That is how we would do pelvic tilting laying on our back.
option again to use the ball or just your body itself. If you like what you see here, be sure to subscribe to Your Fit PT for more tips, tricks, and strategies to care for your body. We'll see you next time.